Hi, I'm Heather with Celebrate Vitamins. I'm the South Central Territory Manager as well as one of the on-staff dietitians for the company. And today I'm going to talk to you about iron. And as we know, iron carries oxygen in the red blood cells to our muscles and helps give us energy. And you may already know that iron deficiency is one of the common side effects of bariatric surgery. And preoperatively, about 3 to 57% of patients present with an iron deficiency before they even have surgery. And as much as 25 to 50% of patients will develop an iron deficiency following their bariatric surgery. And this can often occur within 6 to 9 months or even take up to 3 to 4 years. And it's very important to think about how you supplement iron. You have a couple different options. A lot of people believe in a maintenance dose of iron, which is where you take it every day, and that could be within your multivitamin and or an additional supplementation to help maintain normal blood levels so that you never get low. And it's very important to also know that your risk of iron deficiency goes up over time. So the further out you are from your bariatric surgery, the higher your risk of developing an iron deficiency or iron deficiency anemia. So what are some of the symptoms of iron deficiency anemia? Basically, fatigue, you're going to feel very tired, a low immune system, so you're going to be more capable of catching colds, restless leg syndrome, pica, which is the eating of non-food substances. For many bariatric patients, this includes the chewing of ice. Also, an increased heart rate or even palpitations of the heart and a rapid heartbeat on exertion. So for a lot of patients, they notice it when they're trying to do their exercise routine. They'll notice their heart starts beating a lot faster, as well as a decreased athletic and physical work performance or capability. So it's a lot harder to get in that normal workout that you were used to when you have low levels of iron. Many patients also have trouble regulating their body temperature. They may develop brittle or spoon-shaped nails, have a sore tongue, and even sores at the corner of their mouths. So why does this develop? Well, in gastric bypass patients, they bypass the primary area of absorption for iron, so it's more difficult to get that iron into the body. For all the other bariatric procedures, including gastric bypass, anytime you make the stomach smaller, there's less stomach acid, and iron needs acid to be absorbed. The other reason that many patients develop an iron deficiency is because of an aversion to iron-rich foods, which we'll talk about those in a moment. Let's go ahead and talk about them. So some of the iron-rich foods, you have two classes, the heme iron foods, which are considered animal sources and very bioavailable. And those are going to be things such as meat, like pork, fish, such as cod, flounder, salmon, and tuna, as well as poultry, like turkey. And then you have the non-heme iron, and these tend to be plant-based sources of iron. So kidney beans, baked beans, spinach, enriched white rice, whole wheat bread, apricots, lima beans, dates, and raw broccoli. So as we list those out, I'm sure many of you can think back to your early post-op days or even now and know that those are some difficult foods to sometimes get down. And we didn't mention steak or red meat, which is one of the highest percentages of iron-rich foods, and that's probably one of the top 5 problem foods for most bariatric patients. So you can see why it would be quite easy to develop an iron deficiency if you aren't supplementing appropriately. A couple rules in regards to supplementation. I hate to use the word rules, but here I think it's kind of important. So you never want to take your iron at the same time as calcium, and you want to separate that by about 2 hours. And it's also important to never take your iron supplementation with dairy foods or calcium-rich foods. For example, you don't want to take your iron and then drink a big glass of milk or eat some yogurt. And it's also important to get your blood work done, as iron can be toxic. So more iron is not always a better thing unless you need it and your physician has told you so. In terms of blood work, your surgeon will go over this with you specifically, but you want to check it preferably in the morning when you're fasted, as your levels will change throughout the day. A lot of surgeons will check ferritin, as this is the sign that iron stores are starting to drop, and it's the primary sign of deficiency. However, it's also indicative of inflammation, and as you may know, obesity is a disease of inflammation, so it's not always the best indicator for weight loss surgery patients. Some other labs that they may check include serum iron, MCV, MCH, TIBC, which stands for total iron binding capacity, transferrin, hematocrit, and hemoglobin. So let's talk specifically about our iron that we have available. We have four standalone iron products. We have an 18 milligram tangerine, chewable, a 30 milligram grape, chewable, best tasting in my opinion, as well as a 60 milligram berry, chewable. And for those of you that have been given permission by your surgeon, we also have a tiny little tablet that you can swallow that's 30 milligrams. So let's talk about what makes up these different products. For all of the chewables, they're ferrous fumarate. And the great thing about ferrous fumarate is it's the highest elemental percentage of iron on the market. So you're going to get the most bang for your buck when you take a ferrous fumarate. The other benefit to ferrous fumarate is it's more gentle on the stomach, and we know that's very important when it comes to iron supplementation. With all of our iron products, we include vitamin C to increase the absorption of the iron. And with the tablet, we use a carbonyl form, which is also gentle on the stomach and has a very similar absorption rate to the ferrous fumarate. So check them out and try one today. I'm going to enjoy the grape though. Thanks, and see you soon.